Welcome to Understand All. I'm your host, Aslakir Gerleif. Today, we're embarking on a fascinating journey into the world of Rickets disease. So, buckle up and get ready to explore this intriguing condition that has puzzled scientists for centuries. Rickets, a disease that primarily affects children, is characterized by softening and weakening of the bones. But what exactly causes this condition? The answer lies in a surprising place: the sun. You see, our bodies require vitamin D to absorb calcium and phosphorus, two essential minerals for strong, healthy bones. And the best way to get vitamin D? Exposure to sunlight. Now, you might be thinking, wait a minute, I thought too much sun was bad for you. And you're right, excessive sun exposure can lead to skin damage and even cancer. But here's the kicker: a moderate amount of sunlight is actually crucial for our bodies to produce vitamin D. It's all about finding that delicate balance. Interestingly, rickets was rampant in the 19th and early 20th centuries, particularly in industrialized cities. Picture this: smog-filled skies, towering factories belching out smoke, and children living in cramped, sunless tenements. It was the perfect storm for vitamin D deficiency and consequently rickets. But here's the fascinating part: rickets is still a problem today, even in developed countries. In fact, the United Kingdom saw a 39% increase in hospital admissions for rickets between 2009 and 2011, according to the National Health Service. So, what's going on here? Well, it turns out that our modern lifestyles might be partly to blame. With more time spent indoors, slathered in sunscreen, and consuming processed foods, we're not getting enough of that precious vitamin D. And for some populations, like those with darker skin or living in northern latitudes, the risk is even higher. But here's the good news: rickets is entirely preventable. By ensuring adequate vitamin D intake through safe sun exposure, a balanced diet, and supplements when necessary, we can keep our bones strong and healthy. And for those who do develop rickets, prompt treatment with vitamin D and calcium can work wonders. Now, I know what you might be thinking, but I heard that vitamin D supplements are useless. Well, let's bust that myth right now. While it's true that some studies have questioned the benefits of vitamin D supplements, the fact remains that they can be a lifesaver for those who can't get enough through sun exposure or diet alone. The key is to work with your healthcare provider to determine the right dose for your individual needs. But the story of rickets isn't just about vitamin D, it's also a tale of public health triumphs and challenges. In the early 20th century, the discovery that cod liver oil could prevent and treat rickets was a game changer. And in the decades that followed, fortifying foods with vitamin D became a widespread practice, helping to reduce the incidence of rickets dramatically. However, rickets hasn't disappeared entirely, and it remains a significant problem in many developing countries. According to a 2010 study published in The Lancet, the prevalence of rickets can be as high as 9% in some regions of Africa and Asia. This disparity highlights the need for global efforts to ensure access to adequate nutrition and healthcare for all children, regardless of where they live. But the impact of rickets goes beyond just bone health. It can have far-reaching consequences for a child's overall growth and development. Delayed motor skills, muscle weakness, and even seizures can all be associated with severe cases of rickets. That's why early detection and intervention are so crucial. So, what can we do to prevent rickets and promote strong, healthy bones? First and foremost, it's about education and awareness. By understanding the importance of vitamin D, calcium, and phosphorus for bone health, we can make informed choices about our lifestyles and diets. For parents, ensuring that infants and children get enough vitamin D is especially critical. The American Academy of Pediatrics recommends that all breastfed infants receive a daily vitamin D supplement of 400 IU, as breast milk alone may not provide sufficient amounts. And for older children and adults, a combination of safe sun exposure, a balanced diet, and supplements when needed can help maintain optimal vitamin D levels. But it's not just about individual actions. Public health policies also play a crucial role. Continued efforts to fortify foods with vitamin D, promote breastfeeding, and ensure access to healthcare and nutrition education can all help prevent rickets and promote bone health on a population level. As we look to the future, ongoing research into rickets and vitamin D holds exciting promise. From new treatment approaches to a deeper understanding of the genetic factors involved, scientists are working tirelessly to unravel the mysteries of this complex disease. But perhaps the most important lesson we can learn from the story of rickets is the power of knowledge and prevention. By arming ourselves with information and taking proactive steps to promote bone health, we can protect ourselves and our children from this preventable condition. So, the next time you step outside and feel the warmth of the sun on your skin, remember the crucial role that vitamin D plays in keeping your bones strong and healthy. And if you have concerns about your vitamin D levels or your child's risk for rickets, don't hesitate to talk to your healthcare provider. Together, we can work towards a future where rickets is a thing of the past, and every child has the opportunity to grow up with strong, healthy bones. And that's a wrap for today's episode of Understand All. I hope you've enjoyed this deep dive into the fascinating world of rickets and vitamin D. Remember, knowledge is power. And by staying informed and proactive about your health, you can make a real difference in your life and the lives of those around you. Until next time, stay curious, stay healthy, and keep exploring the wonders of science.